Cool, welcome. Welcome to Focus Physio. We're fortunate to have joining with us Adam Meakins all the way from UK. Thank you for joining us.
Thanks for inviting me.
So we're down here at the Perform 360 in Brisbane, Enogra, and Adam's doing his course, Shoulder Complex Doesn't Have to Be Complicated. So I follow your stuff for a very long time. I'm reading your blogs. I just love your opinions. Like I was saying before, no one has to agree completely with you. Everyone has their own opinions.
Yep.
But I just want to honour you and thank you for
Honour me?
Yeah.
No, don't honour me, mate.
I guess, but sort of honour for challenging professions to not be caught up with the latest fad and
thank you very much.
And just I guess being a devil's advocate and challenging people's thinking, not just get sold on the latest fad treatment and so on.
I think they call it a obnoxious git
Yeah.
in the UK. That's
right.
That's what I probably call most of the time, rather than say challenging opinions, just an obnoxious git.
Yeah, I guess for myself, there's so much to the human body, and I guess there's so much to the human body that we don't know as well. Some treatments could work for some people. Why? Don't know. Couldn't tell you.
Yep.
And I guess I love your honesty in that as well. When you have some clients come to you with conditions and you can just tell them, look, I don't really know. I think that's a lot more of what we need as well. Just to
absolutely.
say, sure, there might be all these kind of A, B, C, D, E, F type therapy, which don't know how it works, but hey, it seems to work for some people.
Yeah.
And I guess who am I to say that it doesn't work because it's worked for you?
Yeah.
Whether just because it didn't work for me doesn't mean that it doesn't work for you.
No.
And that's I guess how I've seen it. I guess people don't have to agree with everything you say, but once again, we all have a mind of our own. I guess I just got a few questions for you.
Far away.
So back then, I guess in the olden days of physiotherapy, everyone used to be manual therapy based. And now we're kind of being pushed to exercise.
Yep.
Do you think that one day we'll come to a middle ground where there's a little bit of manual therapy, but a little bit of exercise as well?
I think it depends on what profession you're talking about.
Sure.
Because I've got a belief that I don't think the manual therapy belongs in healthcare.
Sure.
It's a service. It's not an essential necessity to help people with their health-related problems.
Right.
So I think if you work in a profession that isn't based within the healthcare services, that is being using or utilising, national resources or even insurance companies' resources, then I don't think manual therapy should be used in that profession. So if you're working in that, then no. But again, in the services, I think, massage, manipulation, mobilisation, whatever you want to call it, has a role to play, because it is a service that, as you say, works for some people, feels better, but it shouldn't be given on the healthcare.
Yeah, right. And I guess, now what is your opinion on the thoracic spine in shoulder issues?
It is something that we know, biomechanically affect shoulder mobility. But when you look at its relation to incidences of shoulder pain or pathology, it's very poorly correlated. So I think, it's something for us to consider, but it is low down on my priority list.
Right. One of the papers that you gave Lewis, he talked about taping as sort of like a symptom modification procedure, followed by exercise. What are your thoughts on that? Sort of to just as a reinforcement type tool.
Okay, well, I'm going to get to that tomorrow, because I'm going to cover that a little bit more. But I don't believe we need to be symptom modifying people. In fact, I think sometimes it does more harm than good. I'm not going to say always, but for a lot of people, we sort of contradict ourselves, because we tell them 1 minute, pain's okay, I've done my assessment, it's safe, you've got nothing here to worry about, it can get going, you can keep moving, and then we do the exact opposite and contradict ourselves by saying, I need to take your pain away, I need to reduce it. And I think what that does implicitly, without us knowing about it, just sort of confuses the patient.
Okay.
So we're giving them advice and education. It's okay to move, but we just need to take your pain away before we're allowed to move. And I just, it doesn't make sense to me.
Okay.
So I'm very much a believer of sort of asking my patients not to be symptomatic. I tell my patients, my job is not to take away your pain, it's to make you to be able to tolerate it, endure it, and crack on with it.
I guess we want patients to be resilient and robust.
That's exactly what I try to do. That's my practice now, is to say, is a lot of the time I don't need to take your pain away. In fact, you don't need to take your pain away. Back pain, shoulder pain, it goes. You just need to know how to manage it, deal with it, cope with it.
Yeah.
That's our role.
Excellent. Just last few questions. Now, post-surgery, would your first goal would be to obtain range of motion first or to strengthen first?
Again, dependent on the person, so depending on the situation, the context. I think I see range of movement improve with strengthening exercises anyway. So I talked about today, using eccentric strengthening exercises to restore mobility, so you can do the same at the same time.
That's right. Just
same time.
strengthen to lengthen.
Strengthen to lengthen.
Cool.
Yeah. Strength stretching.
Strength stretching. Awesome. Thanks very much, Adam, for this quick fire round.
No worries.
I hope you found this session helpful. Cheers, Adam.
Peace out.